What if I have a gag reflex during a barium swallow? Imagine sitting in the exam room, ready for your barium swallow test, but suddenly your gag reflex kicks in. It's a natural response that helps protect your airway from choking. During a barium swallow, you drink a chalky liquid that contains barium sulfate. This substance coats your esophagus so doctors can see how well it moves food down. Sometimes, the texture or taste of the liquid can trigger your gag reflex, making swallowing uncomfortable or even difficult. Having a gag reflex during this test is quite common and usually not a reason to worry. It does not mean you will choke or aspirate food into your lungs. Aspiration is when food or liquid enters the airway, but studies show that a gag reflex does not reliably predict this risk during swallowing tests. The radiologist or technician performing the test is trained to help manage this. They might adjust the thickness of the barium mixture or suggest different swallowing techniques to make it easier for you. The flavored barium, like chocolate or strawberry, is meant to make swallowing more pleasant. Still, the chalky texture can sometimes cause gagging. If you feel like you might vomit or if gagging causes nausea, tell the staff right away. They can pause the test or help you breathe and relax. Sometimes, changing your position or holding your breath briefly can help reduce gagging and improve the images the doctor needs. After the test, drinking plenty of fluids helps clear the barium from your system. This can also reduce any residual discomfort or bloating. In rare cases, if your gag reflex is very strong and prevents completing the test, doctors might suggest alternative options. These include a modified barium swallow with videofluoroscopy or an endoscopic exam, which uses a thin tube with a camera to look inside your esophagus. Remember, your gag reflex is a normal protective response. It does not interfere with the main goal of the test, which is to give your doctor a clear picture of your esophagus and help diagnose issues related to acid reflux or gastroesophageal reflux disease. With the help of experienced medical staff, most people can complete the test comfortably despite a sensitive gag reflex.